Hi, my name is Amber Clements Fore. I'm a DNP student at Arkansas State University. The title of my project is Knowledge, Attitude, and Practice of Nicotine Use Among Youth. So, my research question is: will implementing a parental teacher education class regarding nicotine use among youth in rural areas improve awareness and decrease nicotine use after completing a community awareness presentation of the dangers of nicotine among children? My DMP translation project had two aims. The first, to establish the number of teenagers in the 9th through 12th grades in rural school districts who have ever used nicotine products. And number two, to establish knowledge of nicotine use among youth from the perspective of parents and educators. My objective was to evaluate awareness of nicotine use, delivery of electronic cigarettes and jewels among youth, and to develop a plan of cessation. The design of my project used two existing tools, one developed by the CDC and one developed by Dr. Jessica Pepper from the University of North Carolina. These were used to evaluate knowledge, skills, and attitudes of use of electronic cigarettes. There was a pre and post survey that was delivered in conjunction with an educational seminar given to educators and parents. A survey tool, which was used by the CDC, was delivered via SurveyMonkey to high school students to evaluate the knowledge and use of electronic cigarettes. The setting of my project was at Cave City High School, which is a rural area in Arkansas. It involved two populations: high school students, grades 9 through 12th, and high school staff and educators and parents of high school students, 9 through 12th. Excluded populations were those students that were not in the high school and those that were not parents or educators affiliated with high school students. Informed consent was included on both surveys. So, unfortunately, the results of my Survey Monkey on high school students were not surprising. 93% admitted to have heard of Juuls or electronic cigarettes. 54% said they had used these devices. 11% said they used daily. 15% said socially. 11% of these children said they had received their devices from parents or another adult. However, 91% said they do not think that vaping is healthy, and 73% that use said they would be willing to quit. And the gender was 52% male and 48% female, and it was grades 9 through 12. On my adults, educators, and parents, 56% were female, 44% were male, 100% non-Hispanic. 10% said they were smokers, 90% said they were non-smokers. 0% were current vape users. 3% they said they had used in the past. 100% said they learned about electronic cigarettes from the media, and 8% said they know nothing at all, with 13% saying they knew quite a lot. However, 85% said they would be interested in learning more about electronic cigarettes. On the post survey, um, the knowledge did change quite a bit. So when it says, "Would you be interested in learning more about electronic cigarettes?" 90% said yes. How much did you know about electronic cigarettes? It went from nothing at all at 3% to quite a lot at 46%. The belief and attitude portion of the post surveys also changed quite a bit. Electronic cigarettes are safer to use than regular cigarettes. 0% strongly agreed. Electronic cigarettes are a helpful aid in smoking cessation. 0% also strongly agreed. 47% think that electronic cigarettes may be a conventional gateway to cigarette smoking. 82% said that they do think that it's a public health concern. 79% think that electronic cigarettes should be regulated in work and public places, and 85% stated they were extremely likely to counsel a family member on electronic cigarettes. So, lessons learned, need for future scholarship. There needs to be vaping cessation aids for youth To date, there are no pharmacological treatments available. There's a need for age-appropriate cessation tools. Early screening is also important. We should incorporate this in all sick visits and well child visits, begin with elementary and middle school ages, and we need to collaborate and improve knowledge, belief, and attitudes with our community leaders, school officials, and parents.